Welcome to this segment of Our Ventura TV. I'm Nicole Von Dam, and our guest today is Karen Atlas, who is a physical therapist for dogs. Welcome, Karen. Thank you for coming.
Thank you for having me, Nicole.
So for our viewers who may not be familiar with physical therapy for dogs, is it the same as rehab and physical therapy for people?
Surprisingly, it is. It's very similar. We as a physical therapist, we learn how to use different types of physical modalities like light energy and electricity and sound. And then we also have a variety of manual therapy techniques, and we look at the whole animal like we do a whole person when we're working on humans. And with that, we can find out what kind of movement patterns need to be corrected and help with pain reduction. So yes, we as long as we have gone through physical therapy in school and have been licensed in physical therapy, and then have gone on for special education and been certified in canine rehabilitation, it works very nicely to transfer all the human techniques onto the canine.
So what is the American Physical Therapy Association, and how does animal physical therapy fit into that?
The American Physical Therapy Association is our trade association. It's our physical therapy association that brings together all of the licensed physical therapists that want to make better strides for the future in physical therapy.
And that's for humans as well as?
Yeah. That is for humans, and then there is an animal physical therapy section that underneath the orthopedic section, there is an animal rehabilitation special section that's devoted just to animal rehabilitation.
And what type of conditions might a dog have that could benefit from animal physical therapy?
Right. There are a lot of different kinds of conditions. There are anywhere from orthopedic injuries, so sprains and strains or fractured bones, to more intense problems like neurologic problems and spinal cord injuries. And just like you see in human physical therapy, anything that you can see for a human, you can do on a dog for the most part, in terms of getting them rehabilitated. So we can have a orthopedic injury, a sprain, strain, or a torn ligament that we are trying to rehab from, and we start with, first of all, decreasing pain and decreasing inflammation through the different kind of modalities that we use in physical therapy. Modalities meaning the light energy that I was talking about, we use in the form of laser, sound energy we use in the form of ultrasound, and electricity we use in the form of electrical stimulation. Those are all different kinds of modalities that are used in rehabilitation.
Is that like a treatment? A modality is like a treatment?
Yeah, it's a treatment. It's a treatment. It's a type of treatment that are used in conjunction with each other to reach the final goal of improved quality of life. So when we use ultrasound and electrical stimulation and laser therapy and manual therapy, especially for physical therapists that have a lot of training in manual therapy techniques, we can, as physical therapists, we can make profound differences in decreasing pain and increasing function through our manual therapy skills. So we can anywhere from arthritic conditions for older dogs, geriatric dogs, to sprains and strains and ligament tears like I was talking about, and then also neurologic impairments. So degenerative changes, yes.
Or maybe a dog isn't put together right from birth.
Yeah, there's congenital problems. They're not put together right at birth, and it leads to problems later that you can't always correct, but you can improve. And it's really improving their quality of life that is what our goal is for physical therapy and animal rehabilitation.
And do animal physical therapists work closely with veterinarians?
Yes, they do, yes. We love to work in a collaborative approach with veterinarians, much like our human medical model, where we work in as a team approach to healthcare. And I think that is really the key to quality animal health care, is all working together for a common cause. So yes, we like to all work together as a common, each person has their specialty in the healthcare realm, and if we're all working together, I think we can all reach our goals for the patient in the best way.
And what about, there's so much special equipment for people. Is there special equipment for dog physical therapy?
Yeah, a lot of the people equipment can be used on dogs in a little different way, using a little different parameters. And then you got to think about the way dogs move. They move very different than people. They move on 4 legs, we move on 2. So in understanding the biomechanics of dogs and the way their movement patterns, and having that understanding, you can use a lot of the same equipment that we use for people, but use them in dogs in a modified way. So we use a lot of the inflatable, balance balls, for instance, and the peanut balls.
How would that be used with a dog?
With a dog, yeah. So we actually get the dog on top of these balls, and getting them on these inflatable balls gives them it challenges their balance, which causes them to have to contract their core. Building core strength, just like we need to do in humans, you have to build core strength to have a healthy back. We do the same in dogs by getting them on these different types of balance equipments and challenge their balance to improve their core strength.
And how about water therapy?
And then we have water therapy. So there's a lot of aquatic therapy that's done in humans, but it's also done on dogs. So there are underwater treadmills out there that the dog gets loaded into a large box, basically, with glass sides, and then the water's raised up to, depending on what we're trying to accomplish in therapy, the water's raised up, and if we're trying to really decrease the amount of load on the joints, we fill the water to about their shoulder height, and then they can walk in the water with much less impact on their joints. So you're able to exercise them in ways to improve their strength and endurance, but without the impact on their joints. So we use a lot of water therapy in animal rehabilitation as well.
Are the glass sides important so you can see the progress, or just coincidence? Or?
Absolutely, it's by design. And it's designed so that the dogs feel more comfortable, so that they don't feel trapped and they can't see. But it also gives the practitioner the ability to watch the animal's gait pattern, and they can see how the dog is moving. If there's compensations that are being done, then it can be corrected by the practitioner. And so it is by design that those sides are all glass or plexiglass.
What kind of prosthetics are there for dogs?
So there's different types of orthotics and prosthetics that are made especially for dogs. Depending on what the problem is, they have specialized orthotics and to help correct keeping joints stable, basically. You want to, if for the hock or the ankle joint, oftentimes they are loose in the ankle joint, and so you can get braces or different types of orthotics made to help support the hock. And same with the knee joint. If there's a torn ligament in the knee, there's a really common injury actually is the cranial cruciate ligament tear, which is the same as our anterior cruciate ligament, our ACL. It happens all the time in humans, happens all the time in dogs as well. The reason why it happens is totally different, and the surgery for it is totally different, but the idea of the rehab and strengthening around the joint and building in a better gait pattern for the dog is all things that we do in animal rehabilitation. And braces can also help with those kind of problems as well.
What about artificial limbs or carts?
Yes, they have artificial limbs that are made. Those are though dogs do very well with 3 limbs for dogs that have had amputations, there are opportunities to have an actual limb constructed as well to improve their function. Carts are used quite often as well. in neurologic cases, so dogs that have had spinal cord injuries, that don't have use of their back legs or their front legs, depending on what's wrong with them. Again, the cart is made specifically for them to meet their specific needs.
And what is the role of a dog physical therapist with helping a dog with their prosthetics?
The role is to determine what kind of prosthetics or orthotics or assistive device is needed, and then to determine what is needed, and then to actually do all the measurements and do the castings if necessary. Depending on what is needed, you need to do different types of procedures in order to get the custom piece of assistive device. So for the physical therapist or the rehab veterinarian, they can determine what type is best suited for the animal, and then make the order and do all the measurements that are needed.
And you mentioned the special training.
Yeah.
What if we have a viewer that says, this is something I'd be interested in doing?
Right.
What advice do you have for them?
My biggest piece of advice is for the viewer, if they're seeking out these services, is to find a qualified practitioner. To find a qualified practitioner, a physical therapist does not learn these types of techniques on dogs in physical therapy school. They need to learn these techniques and the differences in canines versus humans and do the comparisons in a extended learning program. So there's a certification for that. Same is true for veterinarians. There is the limited amount of education in the veterinary program one will need to look for a veterinarian that also has the extended educational.
So it's a specialization.
It's a specialization, yes. So there's 2 programs in the United States that offer certifications in canine rehabilitation. One is the Canine Rehabilitation Institute, and one is through Northeast Seminars, and that is a program out of Tennessee. And for a viewer to find a competent practitioner, you can look on either of those websites, and on there's a Find a Practitioner site that you can click on to make sure that who you're looking for is actually competent in this specialty field of animal rehabilitation.
And if a viewer was interested in pursuing a career in this, what advice do you have?
My advice would be to be, you would need to go through physical therapy school, which is a doctorate program.
For humans?
For humans.
Okay.
And then go on for advanced certification in one of the 2 programs that I just mentioned. And same is true for the veterinarian. The veterinarian would need to go through veterinarian school, which is a doctorate program as well, and then also go on for advanced certification and education in one of those 2 schools to become competent as well. So.
And in your travels, as you talk to other animal physical therapists, and through your own experience, what would you say are the most rewarding aspects of this career?
By far, the most rewarding aspect is making a difference in lives. And in lives, I mean in human lives and in dogs' lives. So at the forefront is we're making a difference for the dog's quality of life. But in that, the person that is bringing them in, they are treating their pet. We treat our pets like our family. They are our children. And we often treat our pets with that amount of love and care. And if I am given the opportunity to make a difference in that pet's life and then see the difference that I can make in that family's life, it is by far the most gratifying part of my job.
I so wish we had more time. I could talk to you about this for a long time. Is there a website our viewers can go to learn more?
Yes, there is. The viewers can go to www.atlasrehabforcanines.com or to www.caapt.org.
Thank you so much for coming.
You're welcome. Thank you for having me.
This is Nicole Von Dam signing off for this segment of Our Ventura TV. I hope you had a doggone good time.